Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Glad to be with you.
Glad to have you along again. It's always interesting to see what our new topics are going to be. And this week, we're going to talk about bridge building. And who would have ever thought 3.5 years ago we'd be talking about this?
Right? Yeah. So I got a text yesterday from an old colleague of mine that was an Air Force doctor like me. We were down in Valdosta together, Valdosta, Georgia, and he's in Ohio now, and he's on the faculty in a medical school there. And he happened to reach out and say, "Hey, what do you know about high-dose ivermectin and cancer?" And I happen to know quite a bit about that. So hence the bridge building process that I'm excited to be a part of, and I think is a very important thing for the health and wellness of not only this country but beyond. But we had a probably a good hour conversation last night, and he actually took an integrative medicine course, and that's what we have here, Dave. It's an integrative clinic where we use a lot of different tools, the traditional, the non-traditional, alternative, and we try to find the best of both worlds and make it work in a way that helps the body heal. And ironically, he was sharing with me about 5 years ago or so, he had taken a course and gotten some training in integrative medicine. And at that point, a lot of the traditional doctors were kind of tiptoeing around some of the stuff that were being talked about, all the things, the toxins, the poisons, the leaky guts, what is this hyperbaric stuff, or what is ozone, or what are all these different modalities that we didn't learn about much in medical school. And so everybody was kind of, 5+ years ago, very tepid, very cautious with it, but intrigued. And then, voila, COVID comes along, and that whaps everybody over the head, and we start to question some things. And so, this individual, he's like, "Oh man, I really feel my heart is where you're at and doing what you're doing in helping people actually do what we set out to do when we went to medical school, was to get them better." And so, I wouldn't be surprised if he's going to be on his way out here for a little retreat, and so that we can create a little bridge, for him, because it's like, I would not have gotten down this path, of course, if I hadn't prescribed ivermectin and been fired, but I'm thankful to God that this opportunity has arisen, and now I get to be a bridge for patients in the traditional world that don't know anything else, to try to come into this alternative, holistic combination, integrative world. And I can start to do the same thing for other physicians, because there's a huge appetite, Dave, for doctors that were trained traditionally in medical school like myself, that they just don't necessarily know how to get from point A to point B. And because it's a big task to say, all this capital that you got to figure out, and funding, and then I've never been a businessman before. How do you do that? Never run a clinic. All those things, and then you learn a new language of how are we working in an integrative fashion, a functional fashion, or a terrain fashion to get the body into this balanced state, reduce toxin load, help with certain modalities. And it's a process, and it can be kind of an overwhelming, daunting process, but nonetheless, he was so jazzed up last night when I was telling him some of the stories, some of our guests that have been here that we've seen some incredible success with, and he's like, oh, he wanted to be part of that. So I feel like, this bridge making it's a big deal. In fact, I've got another doctor that I met at a conference out in Chicago a few weeks ago, Dr. Robinson. He's an internist, and he's an MD, so he does hospital medicine, and he's saying the same thing. He's like, how do I get from point A to point B? I see that you're doing some pretty incredible stuff at your clinic there. I want to come out and check this out. So he and his wife are coming out the end of November, and so this is how we change the world. And my doctor friend that I was with down in Valdosta last night in this conversation, it's an honor to walk alongside these folks, because I was there 2 to 3 years ago, where I was still trying to figure this language out and trying to master it. And I wouldn't say we're ever a master of anything. We're always in the mode of learning, but we are always wanting to not be afraid, not be fearful, but to step into the unknown. And whatever you may apply that to, whatever your field might be, your area of interest, stepping into that unknown and trusting that if that's where God is leading you, that you need to follow that gut, follow that instinct, and know that God is going to walk you through that process. So whether or not that's trying to do things differently, whatever the industry that you may be in, if you feel that it's out of balance, mine happens to be in the medical arena, of course, but to be able to walk alongside these folks that, because, we look out there, as we've talked over the last months and year, Dave, the world's not getting healthier by the minute. It's getting more and more out of balance from a health perspective, and more autoimmune cancers popping up, and all these things that we're seeing, and doctors in the grid are starting to see, wow, yeah, really, I'm just kind of kicking the can down the road here. And as we talked, my friend and I were we're thankful for the traditional system. Again, we want the surgeons and the emergency room doctors, and we need the internists in the hospital when people are really, really sick, and we need IV medicine and all those things. But the doctors also in the system, I think, are, some of them quietly, some of them not, are saying, "Ooh, I'm kind of curious about some of this other stuff that's out there that wasn't necessarily part of our training."
Right.
So that's where we're going.
So just if I can go back to the last couple of years, since this Band-Aid has kind of been ripped off the traditional medicine, and seemingly never before the own people in the medical system didn't really have a reason to look inside. Well, when COVID came about, that triggered a lot of them to look inside. And so now we've started to see studies seen where, okay, maybe statins is not the best thing. Maybe cholesterol is not as bad as they make it out to be. Maybe your gut health actually equals brain health. And I ran across, we've been talking about the means a lot. Well, Cali Means had this for us this week. The United States, now get this, United States is 4% of the world's population, produces 70% of the world's pharma profits, and we have the 60th ranking in global life expectancy.
Right.
And
so that's a lot of dollars for not a lot of results right there.
I was going to say that does not equate. And so when you started this whole thing, and you are completely on board that sometimes you do need that pharmaceutical, without a doubt. But
Correct.
What's the root cause of your disease?
Right. Yes. and what are the other tools that we can use? And there are, what I found is there's so many ways. Excuse me, so many ways to get there, Dave. And everybody's unique. Everybody might respond, one way better than another way. But there are some and that might be the gut. That might mean hyperbaric therapy is pretty doggone good for a whole host of people. But yeah, everybody does have their unique genetic makeup and their own environmental toxin exposure history. So we have to look at everybody uniquely and try to figure out, okay, where can we start to bring that body? Because again, God created us with these systems, these self-healing systems that are absolutely incredible. And I found that in many ways sometimes we can get in the way of these healing systems and trying to do too much in some cases. But if we go in and do more of a supportive role, let's give you some pressure, let's give you some oxygen, let's give you what you're deficient in, let's feed you better and clean up your nutrition, your diet, all of a sudden some pretty beautiful things start to happen in that body that you don't necessarily even need to know all the biochemistry all the time of why. Well, God knows why. Mm-hmm. And He knows all the details, and we know some of the details. But you start to do some of those things, and that self-healing mechanism is a powerful mechanism if you give it what it needs to kind of get back on its feet.
I thought it was interesting yesterday. I thought this wave is really starting to take shape. Robert Kennedy Jr. talking about returning tallow to the fry machine at McDonald's.
Right.
I mean, seriously, Who would have thought we would have been talking about seed oils and tallow a couple years ago? But that's what's all been uncovered.
Yeah, his tweet even had hyperbarics in it, and ivermectin, and hydroxychloroquine. Yeah. So it made me smile. So, yeah, absolutely. These things that were not on our radar and in our realm 3-4 years ago, they're there now, and they're not going away. There's a hunger and a desire. Everybody, again, we've had these stories that have come into the clinic and every week, and it's the folks that we want to make your next story that success story where you are getting that quality of life back and you're having that energy that you desire and you are aging in a way that is the way you want to age, where you can do the things you want to do and do them without extra pain. So let's make that your story, your journey, and that's everybody across the country. That's the mission.
Right. And see, these stories would not be going anywhere if there wasn't success. And the reason these stories are building and becoming a tidal wave is people like you and others across the country, they're seeing the success stories, and your colleagues are seeing the successes, and they're like, oh, let's take a look at this.
Yes. It's like rocket fuel. We get so excited. I had a gentleman that he's 45 going on 70, and he's like, man, I'm tired. He's like, I just am aching. This was just a couple weeks ago, and he's an active guy, but his mitochondria, the ATP energy makers were just in distress. And in a matter of 2 to 3 weeks, I reached out to him earlier this week. Here's another success story. He's got type 1 diabetes and his blood sugars have gone down, but he's got more energy already. He's got less inflammation, and this is 2 weeks into this. Who wouldn't want to be a part of that? That's exciting.
Yeah.
That's exciting for him. It's exciting for me. And again, that's where that, like I say, the bridge, we need to make room for other folks to come on board and to train people. I think one of the big things, it's the cost. People, they're in the system, and to come up with the capital to do these things, that's something that's going to have to be figured out throughout this country, because you're going to have this tidal wave of doctors that want to do this differently. But how are they able to get from A to B, even from a financing it perspective? So it's things that need to be worked out. But the exciting thing is it's happening. People are feeling better. People are recognizing all of this imbalance that's out there. The why, this individual also interesting. I think it's called Dark Water. It's a movie, and this individual that I was telling you about that I talked with last night, this doctor friend. He's near DuPont, and the cancer rates are through the roof around there. When you start thinking about Teflon pans, things like that, and so it's a movie called Dark Waters. I think it's Dark Waters. It's a very interesting insight into that avenue as we talk about identifying all the different toxins that are out there. Yes, it's an exciting time. I'm very grateful, very thankful, and as we move forward, Dave, I just wanted to kind of in the coming weeks here, a little bit of a tease here of what's to come. I want to talk a little bit more about cancer and the approaches with that, and I also want to talk about. I'm going to bring on an incredible member of my team, and I want to start to bring on some more members of my team here, so you get to know them and hear their voices and hear their story and their why. But we've had Molly on before, our functional nutritionist. She's just fantastic. We're going to bring her on board next week or the following week to get going on some exciting topics.
Okay.
The 6 M's of wellness. And the mitochondria is in there, and so maybe we bring her on once a month, something like that, to kind of get the functional nutritionist perspective on the 6 M's and beyond, because she's a wealth of information and will be fun to have part of the discussion.
Very good. Listen, we've got to run. Folks that want to come see you and peel back the layer of that onion and get to feeling better, how do they make that happen?
Give us a call at 712-339-6024. Discovery calls are always available. It's a 15-minute complimentary visit with me to discuss your case and where you're at and how you might plug into our integrative clinic here. We're at 3305 Berkwist Avenue in Spirit Lake, just off Highway 71. Get on board if you're really looking for something different and you're feeling like you're not gaining traction in the direction you're going. Then it might be time. It might be time to give us a call and make some of these success stories you've heard about, make that your success story and get living better.
Very good. Dr. Meyer, always a great pleasure. Have a great day. We'll chat soon.
Sounds great, Dave. Thank you.
Dr. Bradley Meyer, the Okoboji Wellness Clinic. You can find out more online as well, okobojiwellnessclinic.com.